Now coming to RBC transfusion. RBC transfusion is based on your baseline hemoglobin, potential or actual ongoing bleeding. What is the rate and magnitude of the bleeding in the perioperative period? What is the intravascular volume status? Any signs of organ ischemia, for example, anemia causing coronary ischemia, and adequacy of the cardiopulmonary reserve. These all the various factors which determine your RBC transfusion. RBC should be administered by each unit by unit, and with possible you always re-evaluate before going for the next transfusion. So, when you give RBC, healthy patient has no comorbid, average might have 1 or 2 comorbid, poor will have 3 to 4 comorbid. So, in case the patient is healthy, if you lose about 30% of blood volume, you can go for an RBC transfusion. In average patient, if the blood volume is 20% loss, you go for a transfusion, and in a poor comorbid, lot of comorbid is there, in those cases even 10% volume loss is there, you have to go for a RBC transfusion. With regard to hemoglobin, you go with less than 7 to 8 gram per deciliter in a healthy individual. In average, that means the patient is having 2 to 3 comorbid, you transfuse when you have 8 to 9 hemoglobin. In a poor moribund patient, you go with less than 10 gram per deciliter. With regard to hematocrit, in a healthy individual, if it is between 21 to 24, you go for transfusion. In average patient, if it is between 24 to 27, you go for transfusion. In poor patient, if it is less than 30%, you go for transfusion. This is how you decide a transfusion based on hematocrit, hemoglobin, and the loss of blood volume. Now coming to a terminology called maximal allowable blood loss. Here you calculate the blood volume, which is nothing but weight into 75 ml per kg in a normal adult, and you have a target hematocrit. The normal target hematocrit is around 40, and you look at the patient initial hematocrit. What is the patient initial hematocrit? And divided it by target hematocrit. Here, for example, you assume that the patient weight is 70 kgs and the blood volume is 70 into 75 ml, which comes roughly around 5 liters, and your target hematocrit is around 40 and the patient hematocrit is around 27. When you put the appropriate values, you get a value of around 1700 ml, which means that here the maximal allowable blood loss is between 1500 to 1700 ml.